Every 20 seconds, someone suffers a heart attack. Every minute, someone dies from one. Tragically, many have no symptoms and no warning. Until now. Now there's a test that can give you a prior warning and perhaps save your life. It's Life Test. A Life Test scan can detect heart disease before you have symptoms. Life Test uses ultra-fast CT electron beam computed tomography technology, recognized by the American Heart Association as the best non-invasive test in predicting heart attack. Your doctor may have referred this test because you are having symptoms or have risk factors for heart disease. Or you may have heard about Life Test's life-saving technology in the media and decided to find out for yourself. Most heart disease is caused by atherosclerosis, which is the buildup of fatty deposits in the arteries that supply blood to your heart muscle. In time, these fatty deposits in the arteries harden or calcify. The Life Test EBT scan detects and measures this calcified plaque in the heart arteries. Life Test uses ultra-fast electron beam tomography, which is 10 times faster than a regular CT.
Speed is a critical issue in CT scanning because there are a number of organs in the body that obviously we can't stop moving. The most important one is the heart. This machine, and the importance of its speed is that it can freeze the heart motion so that the machine can obtain very sharp cross-sectional images of the heart, actually between heartbeats.
A traditional treadmill requires that plaque be built up to the point that blood flow is reduced and you begin to have symptoms. The Life Test EBT scan detects early heart disease before blood flow is impaired. This is important because 2 out of 3 people who have a heart attack have normal blood flow in their heart.
No other test, no other technology comes close to this technology in this early detection and quantification of this disease.
A professionally trained registered CT technologist conducts the entire procedure. There are no special preparations for the test. You can eat before your appointment. There are no needles, no dyes. Your head is not enclosed.
There was nothing to the test. You lay down on the table, you breathe a few times, they take a lot of pictures, and it's over in 10 or 15 minutes.
Go ahead and rest your arms down. I'll be right there. What happens is the scanner takes slices of the heart from the top all the way down, and those slices are very thin. They're only 3 millimeters thick. And so consequently we get an excellent visualization of each area of the heart. And our particular scanner is the fastest scanner available and the only scanner that can do this at such a quick scan time. And what we do that other scanners are not able to do is we're able to actually capture pictures of the heart without any motion at all, which is very, very important.
Life Test's customized computer software measures and analyzes the amount of calcified plaque, giving you a numbered score.
This particular patient's calcium score is 116, which is considered mild.
This score is compared to other patients in your age and sex category. The software also reconstructs the image slices into a 3D picture of your heart, which the cardiologist can examine from any angle.
This new technology, the electron beam scanner, gives us, as doctors, particularly as heart doctors, a unique opportunity to look at the heart in its normal setting inside the chest. Of particular interest are the arteries that bring the blood to the heart muscle. The scanner is looking for areas of cholesterol buildup or blockage, and they would show up as little white spots. But this patient is quite fortunate. There are no white spots. The arteries are open and clean, and all these branches are clean, clear, free of heart disease.
Since the EBCT scan images the chest, incidental or non-cardiac findings are another remarkable capability of this technology.
When I started having persistent indigestion, I just thought, well, I need to be checked. And so we did, and the heart was fine, but we picked up hiatal hernia.
At Life Test, board-certified radiologists are frequently asked to review questionable scans for the presence of non-cardiac, frequently unknown diseases, such as this lung cancer in a patient scanned for reasons of heart disease.
This patient has early heart disease. These white spots are a collection of cholesterol binding together with calcium and starting to clog the arteries. And we see several locations, some small, some larger. This spot on the main aorta carrying blood towards the brain, and these smaller spots in the arteries carrying blood to the heart muscle itself. As we get farther out, the arteries are less clogged. Out here they're clear. This patient is an intermediate level of mild to moderate amount of cholesterol and will need diet therapy and perhaps medication to try to stop the further growth of these blockages. And this patient has extensive cholesterol buildup, very worrisome. Here we see even in the very main beginning left trunk, the left main coronary artery, and in the branches that leave that artery, heavy areas of calcification. A patient such as this would certainly need further testing, very likely an arteriogram, or at least possibly a treadmill or thallium test.
After the scan is interpreted, a written report is mailed to you or to your doctor. If there is disease present, recommendations are included so that you and your doctor can discuss your treatment. If there's a life-threatening problem, your doctor is notified by phone immediately.
One of the big changes that has come about as a result of the test has been, of course, the diagnosis that I had major blockages. I went ahead and had to go on through an arteriogram to ensure where those blockages were. I did go through the bypass surgery, had an extremely fast recovery.
Research now shows that with lifestyle changes like exercise, nutritional supplements, and medication, coronary artery disease can not only be stopped, but also the progression of the plaque process can actually be reversed.
And since that time, I now exercise on a much more strenuous basis, 3 miles a day. I eat or watch what I eat much more cautiously. My wife and I both exercise together, and it looks like, based on all the readings, cholesterol, triglycerides, and blood pressure, all my readings have dropped back into normal.
I can go ahead and do what I want to do, what I feel like doing. I don't worry about my health in general. Just to try to do some of the things I need to be doing.
Help spread the word about Life Test. Share this video or CD with a friend.
I recommend Life Test to everyone. I really do. I think it's a wonderful, wonderful thing. If it wasn't, I wouldn't be here right now.
Encourage each other in healthier habits. Educate yourself on healthier lifestyle choices.
It's a great test to know where are you, what's really going on.
Get a follow-up Life Test scan to see if your program is working or if adjustments need to be made. Be responsible for creating your own good health. For more information, visit our website at www.lifetest.com.